Okay, we're going to call to order the Committee on Health and Welfare. Madam Secretary, please call the roll.
Senators Coleman,
Here.
Carter, Arthur, Gannon, Moon, Thompson Rehder, Washington. 5 present.
With 5 present, we do have a quorum. We're going to start today with House Committee Substitute for House Bill 2634. With apologies to my Senate colleagues, the budget chairman has work to do, and we want him to get the budget to us as quickly as possible. So we're going to start with his bill. Proceed when ready.
Good morning, Madam Chair, members of the committee. Representative Cody Smith, representing the 163rd District, here to present to you House Committee Substitute for House Bill 2634. It is the same as the Senate bill a Senate bill you all have seen, which is Senate Substitute for Senate Committee Substitute for Senate Bills 1168 and 810. This bill primarily prohibits taxpayer funding from going to abortion providers and their affiliates. And again, it is the same language as the aforementioned Senate bill. So I'm happy to answer any questions if there are any. And thank you for having me today.
Thank you so much. Are there any questions for the House representative? Thanks.
Thank you, Representative. This bill has been much discussed on the Senate side and in this committee. So I guess I'll just ask one question to you that I'm curious about for anyone who supports this legislation. Why do you think it's appropriate for the government to tell someone that they can't access the provider of their choice?
Well, Senator, this bill doesn't prohibit them from accessing the provider of their choice. It just simply prohibits taxpayer subsidy of abortion providers or their affiliates. So they're still free to choose providers of their choice. In fact, I think any of these entities that are not subsidized through taxpayer funds will probably continue to provide services in the markets that they are in. And so they're free to choose them, and this bill does not prohibit that.
Well, let me clarify. There are people whose provider of choice are professionals at Planned Parenthood clinics, and they've established trust with that provider, a relationship with that provider. They're their chosen provider. And as someone who's on Medicaid, if you are seeking to have that service covered, the legislature, what your bill would do is it would tell that person that they can no longer seek that service from that provider.
Just to be very specific, it would say that we would no longer offer those services under Medicaid with that provider, but they would still be free to choose those providers.
It would be much more difficult for them to receive that service.
It would be impossible for them to receive Medicaid services through those providers,
Mm-hmm.
but there are a variety of other providers that do provide Medicaid services that are also not abortion providers.
So there is a lack of access, and we've talked at length in this committee about how difficult it can be to get into a provider, a healthcare provider throughout the state. There are long wait times, and our healthcare safety net is already pretty strained. So how do you, when I know you say they can go somewhere else, where do you recommend they go, and what do you say to them if it's going to take weeks to be seen instead of a few days or hours?
I would say that in most markets across the state, it would not take weeks. That would be my guess. Just with the work that I've done on the budget side of things, I've seen our social services programs become more expansive insofar as there are different types of providers that are providing primary care services, women's health services, kind of unique services, mental health services, those types of things. And, we've done a lot of work with FQHCs and different types of new providers, primary health care clinics. The state has partnered with a lot of healthcare organizations to provide more primary care access and a variety of different types of services and all, in conjunction with providing more services to more people in more markets. We are interested in helping people stay out of emergency rooms and out of hospitals because through our state's Medicaid program, those are prohibitively expensive. And so I think we've done a lot over the last several years, and I'd be happy to provide you with some information about what we're paying for as a state. And I think that's reflected in the amount of services and availability of services across the state. So I think that the market will provide.
I know I said I was only going to ask one more question, but we were talking about the state paying for things, and undoubtedly this will result in costly litigation. And I guess as a fiscal conservative, how do you want to justify those costs?
You know, Senator, it is my hope that there won't be any litigation around this. There has been litigation in the past.
There will definitely be litigation around that. I mean, and there have been favorable rulings to Planned Parenthood in other states as it's related to trying to prevent Medicaid funding from being reimbursed or from reimbursing Planned Parenthood for those services. So there will definitely be a lawsuit, and I don't know how the courts will ultimately decide. There have been times that courts have ruled on the side of Planned Parenthood, and recently that's been the case. So,
if I may comment, it is my hope that there won't be litigation around this. Perhaps there would be a lawsuit filed. You may know of some folks that intend to file a lawsuit. I am not aware of that, and I will say that with a relatively recent change in federal law, we have seen other states do this. Texas and Arkansas, and I believe Tennessee, are not allowing providers like Planned Parenthood in their Medicaid program, and that has been upheld. And so I think there is a, I don't know if there's case law around it, but there is proven instance at this point that some states are doing this. And again, the unique thing there is, or the important detail is that federal law has changed, and states can be allowed, or the federal government is allowing states to do this. And so my hope is that this is a change in statute. It clearly signals that this is how we want to operate in Missouri. And it's different than the attempts that we've had in the past of doing this through the appropriations process, which I acknowledge, that there was a lot of litigation around those attempts. Have two Missouri Supreme Court rulings that say that we cannot do it the way that we've done it before. This is not the same thing. This is a change in statute. This should be something that is hopefully recognized by all the courts that it is allowable under state and federal law. So that's my hope.
Thanks.
Thank you, Representative. Thank you, Senator. Any further questions for the bill handler? Seeing none, we'll have the first witness in support. Please come forward.
Thank you, Madam Chair, members of the committee. Samuel Lee with Campaign Life Missouri to go on record in support of House Bill 2634. Madam Chair, committee members have submitted written testimony, which I'm not going to read. Last time when we testified, it was about why abortion facilities and their affiliates should be defunded. This testimony is legally, can you do it? And the questions are directly on point. And as you'll read, in both the 8th Circuit, in a Arkansas law, and of course Missouri is in the 8th Circuit, and the 5th Circuit in Texas law, upheld the rights of those two states to defund Planned Parenthood. I know other states, besides Tennessee, Mississippi is also doing it. And there are circuits that have not allowed states to do that. So there's a division among the circuits, and you can read all of that here. I would say also that our Missouri Supreme Court in 2020 set forth a framework of what we need to do in our statutes if we want to defund abortion facilities and their affiliates. And they pointed out some 3 or some odd sections and subsections which are in this bill. So if our state Supreme Court is to be believed, that if this law passes, that there's no cause of action under state law. But whether there'll be a federal court challenge, we'll have to see. But again, we're in the 8th Circuit. The 8th Circuit has upheld it. Ultimately, maybe the U.S. Supreme Court will decide. I'm happy to answer any additional questions. There's also a resource, not something that I often use, but the Guttmacher Institute has a page that talks about all sorts of state efforts, not just in Medicaid, but Title X family planning funding among states, and have pointed out a number of states that do defund abortion providers.
Thank you so much for your testimony. Are there any questions for this witness? Seeing none, next witness in support, please come forward. If somebody could stay after the hearing and help me, periodically we have to move the tables forward again so that whoever's in the first row is able to sit without having their knees bumped by the chairs. So if a couple of you would stick around afterwards, we'll push the tables forward a little bit. Go ahead when ready.
Thank you, Madam Chair. Members of the committee, for the record, Susan Klein, representing Missouri Right to Life, here to go on record in support of House Bill 2634. And we thank Representative Smith for bringing this bill forward and for the Senate sponsors that have brought it forward, too. Missouri Right to Life has been consistent in, coming and asking to make sure that our public dollars do not go to Planned Parenthood and their affiliates. As times have changed and as these court cases have come forward, obviously we've been in the courtroom. The court discussions have been, if you want to defund Planned Parenthood, you're going to need to address that in statute. And even the ACLU in the last hearing that we were in said if you want to defund Planned Parenthood, you need to do it in statute. So we believe that we'll get a good ruling in the court, obviously from the cases that we've seen in other states, that legislative bodies do have oversight over the funds of the citizens of their particular state. And we encourage you to pass this bill and defund Planned Parenthood.
Thank you for your testimony. Are there any questions for this witness? Seeing none, the next witness in support, please come forward.
Good morning, Madam Chairwoman and members of the committee. It's my pleasure to be here today. I'm Sue Liebel with Susan B. Anthony, Pro-Life America, the nation's largest pro-life organization. I rise in support of the bill. In its 2021-2022 annual report, Planned Parenthood reported $1.9 billion in income and $2.3 billion in net assets. Almost $1.9 million a day in government funding. Planned Parenthood excess total revenue over expenses is $204 million. So they are, in fact, like other providers in terms of structure, although nonprofit. Interesting quandary there. Also, the state, of course, is trying to exercise its right to keep its values in Missouri law. So we rise in support, and thank you for your consideration.
Thank you so much for your testimony. Are there any questions for this witness? Seeing none. Thank you for being here today.
Thank you.
Next witness in support.
Thank you, sir.
Thank you, Madam Chair, members of the committee. Jamie Morris with the Missouri Catholic Conference here in support. And we've heard a few of these bills now, and I don't really want to repeat what other witnesses have said, but we want to thank the bill sponsor and the Senate sponsors as well. We have always been in support of this legislation and would be happy to answer any questions.
Thank you for your testimony. Any witnesses, any questions for this witness? Seeing none. Thank you. Next witness in support.
Good morning, Chairman and Senators. Thank you for allowing me to be here. My name is Timothy Faber, and I'm here to speak in favor of Senate Bill 2634. Article 1, Section 2 of the Missouri Constitution states that all constitutional government is intended to promote the general welfare of the people, that all persons have a natural right to life, liberty, the pursuit of happiness, and the enjoyment of gains of their own industry, that all persons are created equal and entitled to equal rights and opportunity under the law, that to give security to these things is the principal office of government, and that when government does not confer this security, it fails in its chief design. Revised Statutes State of Missouri 1.205 states in part that life begins at conception. Unborn child defined, failure to provide prenatal care, no cause of action for. Number 1, the General Assembly of this state finds that 1, life of each human being begins at conception. 2, unborn children have protectable interests in life, health, and well-being. 3, the natural parents of unborn children have protectable interests in the life, health, and well-being of their unborn child. 2, effective January 1, 1988, the laws of this state shall be interpreted and construed to acknowledge on behalf of unborn child every stage of development, all the rights, privileges, and immunities available to other persons, citizens, and residents of this state, subject only to the Constitution of the United States and decisional interpretations thereof, by the United States Supreme Court and specific provisions to the contrary in the statutes and constitution of this state. Number 3, as used in this section, the term unborn children or unborn child shall include all unborn child or children or the offspring of human beings from the moment of conception until birth at every stage of biological development. Therefore, the use of public funds to support any abortion or any facility conducting abortion or any of their affiliates as defined in section 188.015 or any affiliate associate of such abortion facility would be a violation of the Missouri Constitution and state statute, and thus it is proper and required to pass this bill, HB 2634, to codify and clarify the use of public funds in keeping with our Constitution and current statutes. Failure to pass this bill would result in the state funding illegal activity. Thank you, and I'll try to answer any questions you may have.
Thank you so much for your testimony. Any questions for this witness? Seeing none, next witness in support. Thank you, sir. Any other witnesses in support? Seeing none. First witness in opposition, please come forward. Is there anyone here in opposition to the House bill? Well, I appreciate anyone here for informational purposes only?
If you need me to.
I don't think so. Would any member of the committee know? Okay. Thank you so much, Representative, for being here. That'll conclude our hearing on House Bill 2634.
Thank you, Madam Chairman of this committee.
Oh, thanks. Okay, thank you so much for that. I'm going to make a motion that we move into executive session. Do I have a second? Seconded by Senator Thompson Rehder. I'd like to make a motion that we bring before the committee a late addition, Senate Bill 931, introduced by Senator Arthur, which modifies provisions relating to telehealth services. I now make a motion to take up Senate Bill 931. Do I have a second? Seconded. Senator Arthur, would you like to explain your bill or remind us?
Sure. This just extends insurance coverage to audio-only meetings, and there are certain guardrails about that not being the only thing. Providers are still expected to meet in person at different points. But this is a great tool for seniors and people in rural communities to get the help they need.
Are there any questions? Senator Moon.
May I ask a question of the bill sponsor? I don't remember hearing this particular bill, but I am aware that in some telehealth situations, depending upon the resolution of the screens, there may not be, especially if you're looking at visuals, there may be some hiccups in that. So tell me about your bill. And
Yeah, so my bill would help solve that problem. In the event that Zoom or whatever platform it is isn't working, they would have the option of having audio only instead. And you may remember there were witnesses testifying only in support. A lot of those were psychologists who were providing services to people in distress. Those people felt maybe more comfortable without having to get on a Zoom. They were able it just mentally was more comfortable for them to have those kinds of conversations without the visual.
Yeah, I would agree the audio probably would be acceptable. I'm looking at somewhere, even if it would require palpation and things like that, you can't do it over the internet.
Right.
Some of the visuals may not be adequate, and I wonder who might be held accountable if a misdiagnosis was made. But audio, I would totally agree with. So we
It's
can have a
just limits-
conversation about.
Well, so my bill would
additions.
just limit it to audio only.
Gotcha.
Sorry.
Okay.
Or well, not limit it, but it would. Right now, audio only is not being covered under insurance.
Gotcha.
So it would add that.
Great. Thank you.
Any other questions for Senator Arthur? Seeing none, I now make a motion that we vote do pass Senate Bill 931. Do I have a second? Senator Arthur seconds. This is a roll call vote. Madam Secretary, please call the roll.
Senators Coleman,
Aye.
Carter, Arthur, Gannon, Moon, Thompson Rehder, Washington. 2, 3, 4, 6, 0.
By your vote of 6-0, you have voted do pass Senate Bill 931. I now make a motion that we bring before the bodies Senator Gannon, Senate Bill 1260, which modifies provisions relating to prenatal tests for certain diseases. Do I have a second? Senator, yours is on the list too. I'm sorry, it's just the other one was on top. Yes, Senator Gannon's. I apologize. Yes, Senator Gannon, your 1260, which is the prenatal testing that we heard last week. We're executives. I'm sorry, we're in executive session. I'm making a motion to, I need a second to bring before the body Senator Gannon's bill. Thank you, Senator. I now make a motion that we vote do pass Senate Bill 1260. Do I have a second? Madam Secretary, this is a roll call vote. Please call the roll.
Madam Chairwoman, I have a question, if I may,
Sure, go ahead.
of the bill sponsor. I noticed that currently it is with the consent of the patient. Will the test at week 28 also be with consent of the patient? You think? It will
Senator
be?
Moon, it says with consent in the bill.
Very good, thank you.
Okay, great. So, Madam Secretary, please call the roll.
Senators Coleman,
Aye.
Carter, Arthur, Gannon, Moon, Thompson Rehder, Washington. 6-0.
By your vote of 6-0, you voted do pass Senate Bill 1260 with a little bit of stumbling by the chairman. Thank you, committee, for your help with that. I'm now making a motion that we bring before the body Senate Bill 1212, introduced by Senator Moon, which modifies provisions relating to hospital price transparency laws. Do I have a second? Senator Carter seconds. And I now would like, are there any questions for the bill handler? Senator Arthur?
It sounds like you're in the process of maybe making some modifications to the legislation.
Language clarifications, yes.
Okay. I might pass to see if my vote's needed to get it out of committee or not, but I do have a little reservation about some of that language and hope that we can resolve it. Thank you.
And Senator, I wanted to say that after asking for the pricing, MU and SSM hospital systems were able to very, very quickly give me the pricing on those specific questions. So I wanted to thank them for doing so, and I wanted to challenge the rest of our hospital systems in the state to comply quickly with federal law so they could do the same. Okay, now I'm making a motion to vote do pass Senate Bill 1212. Do I have a second? Senator Thompson Rehder is second. This is a roll call vote. Madam Secretary, please call the roll.
Senators Coleman,
Aye.
Carter, Arthur, Gannon, Moon, Thompson Rehder, Washington. Arthur. 5-1.
By your vote of 5-1, you have voted do pass Senate Bill 1212. I now make a motion to take up House Committee substitute to House Bill 2634. Do I have a second? Senator Carter seconds. House Committee substitute for House Bill 2634 is now before the committee. Any questions on this bill? Seeing none, this is a roll call vote. Madam Secretary, please call the roll.
Senators Coleman,
Aye.
Carter, Arthur, Gannon, Moon, Thompson Rehder, Washington. 5-1.
By your vote of 5-1, you have voted do pass House Committee substitute for House Bill 2634. I make a motion that we end executive session and resume hearings on the bills before the body. Do I have a second? So moved. We're now back into regular session, and we're going to hear Senator Carter's Senate Joint Resolution 76. Everybody's ready for spring break, right? Yeah. That's true. Senator, please proceed when ready.
Madam Chair, thank you for hearing this bill. Committee members, it's an honor to bring this bill to you. I'm Senator Jill Carter representing Jasper and Newton County. This SJR is an assistance program aimed to aid individuals and families in need, but their ultimate goal should be to foster self-sufficiency. Work requirements encourage recipients to seek employment, leading to financial stability and a decreased reliance on government assistance, thereby lightening the system's burden. Additional work requirements facilitate skill development and job readiness, potentially breaking cycles of poverty. Moreover, they deter fraud by ensuring aid goes to those genuinely in need and foster social integration and promote workforce participation. Overall, these requirements offer multiple benefits, bolstering the integrity of assistance programs and ensuring aid reaches those most in need. So with that, I will take any questions.
Thank you, Senator. Are there any questions for the bill sponsor? Seeing none, first witness in support of Senate Joint Resolution 76. Go ahead when you're ready.
Chairwoman, committee members, thank you for hearing my testimony today in support of SJR 76. My name's James Woodford. I currently direct a national movement called True Charity that's focused on equipping church and nonprofit leaders with tools and training to be more effective in their poverty alleviation efforts. We have 180 organizations across 30 states that are part of that network, and currently more than 40 of them are within the state of Missouri. This effective charity movement grew out of a mission that my wife and I started 24 years ago in southwest Missouri called Watered Gardens. It's grown to be the largest privately funded poverty-fighting organization of its kind in the area. And we currently meet more than 30,000 basic needs every year. We provide emergency shelter services for adult men and women. We have a family shelter for moms and kids. We have a long-term residential recovery program for men. More closely related to our topic today, we also have a medical respite unit for homeless individuals who are coming out of the hospital but have nowhere to go to finish their recovery. And we also work in conjunction with our medical school, our local medical school, who provide fourth-year medical students to provide health and wellness screenings for every person who walks through our doors. Now, of all the needs that are being met, whether it's a medical need or something like food and clothing, almost all of them are being earned through a ministry that we operate called the Worth Shop. We call it a worth shop because we have learned that work awakens worth in people's lives. Just as an example, a woman named Sarah gave me a phone call after she had earned what she needed for a day in our worth shop, and this was the testimony that she left on a message machine. She said, "Thank you. I didn't feel like I was less than anyone else. You made me feel worthy of what I was doing to give back a little, treating each other as equals, as I feel I was treated today." We see that self-realization of value and worth every day at our mission because we practice charity with an understanding that every single person is made in the image of God with the capacity to contribute, and that failing to call people to contribute is an injustice that robs from them human dignity and puts them on a path toward dependency. So any bill that would be in favor of work requirements for those who are able-bodied is not a cruel or unkind thing. It is, in fact, I think, one of the most charitable things we can do because it restores or gives an opportunity to restore to that person their dignity and the joy of earned success. So I would just urge the committee, let's not steal that from Missourians. Thank you. I'd be glad to answer.
Thank you for your testimony. Any questions for Senator Moon?
Thank you. Dr. Whitford, you mentioned dependency. Are you familiar with the 5 steps to dependency?
I am, yeah. It comes from a book written by Robert Lupton. It's called Toxic Charity. Mm-hmm. And in the book, he delineates these 5 steps. He says, if you give something to somebody once, they'll appreciate you for it. But if you give it to them again, they'll anticipate that you're going to give it a 3rd time. If you give the same thing a 3rd time, they'll develop an expectation. A 4th time, they're going to feel entitled to it. And a 5th time, they'll be dependent on you for it. So it goes appreciation, anticipation, expectation, entitlement, and dependency. And Marvin Olasky, in his book, The Tragedy of American Compassion, wrote, "Dependency is merely slavery with a smiling mask." So if we're going to be good and helpful and kind to people, we've got to help them out of a pathway toward dependency.
And a follow-up, if you'll allow. You mentioned a woman who was encouraged by the help she received at your organization. Have you come across anyone who's been discouraged by what you're trying to offer and help them with?
Oh, yes. Right now we've got a man named Jason. He's about 35 years old. He's in our long-term residential recovery program. He came to us from Spokane, Washington. And he was just sharing with me a few weeks ago that while he was there, he and his wife were both enrolled in their Medicaid program and on some other welfare programs, and admitted that they made the decision to not move toward full-time work, even though it was an opportunity for them, so that they wouldn't lose their benefits. Unfortunately, instead of advancing his work life, he actually became addicted, ended up homeless, and then in our mission. And so it was a sad outcome. Today, of course, he's on the right track.
And you're doing all this without government funding.
That's true.
Impressive. Thank you.
Any other questions for this witness? Seeing none, thank you for being here today. Next witness in support, please come forward. Any other witnesses in support? Seeing none, first witness in opposition, please come forward.
Emily Kalmer, American Cancer Society Cancer Action Network. Thank you for the opportunity to express our concerns with this resolution. Our organization works to end cancer as we know it for everyone through advocacy, and we believe moving this resolution forward would be a step backward for cancer patients, survivors, and those Missourians who might be diagnosed in the future. Expanded Medicaid eligibility, the research has shown, promotes earlier cancer detection, fewer deaths, and improved outcomes for patients. So consistent access to screening and treatment is crucial to seeing those positive impacts. And this resolution would create uncertainty in those efforts and put cancer patients at risk of losing coverage in the middle of their treatments. Last year, I shared with the committee an example of a woman, her name's Darlene, who was able to get coverage for her thyroid cancer through Medicaid expansion. And I just want to give an example using her story as why these requirements that are in this resolution would be problematic, and then just generally for cancer patients and survivors. So Darlene was working at a pharmacy in Kansas City when she fell in September of 2021. Not only did she have to have spinal surgery, but then she was later diagnosed with thyroid cancer that had metastasized to her lymph nodes and chest. She learned in the course of this that her insurance was a limited plan that wouldn't cover her current and upcoming expenses. Only after getting enrolled in MO HealthNet was she able to have the surgery and the radiation she needed. During the course of that treatment, though, she did have to take leave from her job and was unable to work. And now she is again fighting a recurrence of her cancer. So Darlene is an example, like many cancer patients who are unable to work or require modifications in their employment during the course of their treatment. And cancer survivors continue to deal with that as well. So while there may be exemptions in this legislation that are intended to provide for those with chronic health conditions, we've found that those exemptions, the complexity and frequency of reporting has led thousands of people to lose their Medicaid coverage in the one state that has implemented this, Arkansas. So in that case, many individuals who met an exemption category were unaware they were exempt, and while others were unable to successfully navigate the reporting system and lost their Medicaid coverage. So you can imagine losing your Medicaid coverage in the midst of your cancer treatment and how that could impact the life-saving treatment that you're receiving. So, and just one thing, Missouri we know is chronically on the list of those Medicaid programs that it's at the bottom of the country as far as their ability to respond to calls. So when Darlene was initially trying to get enrolled, she reached out to me because it took her months to get her application processed, and she wasn't able to ever get through to anyone on the phone to discuss it, and was worried about her appointment with a surgeon being canceled. So while there may be exemptions provided for in this legislation, we don't have any confidence that those exemptions wouldn't result in cancer patients still losing their coverage in the midst of their treatment.
Thank you so much for your testimony. I have a couple of questions.
Sure.
It sounds to me like your testimony was not against this specific bill, but about this idea of work requirements, because there are a number of provisions in this bill that directly seem to counteract a little bit of some of your concerns. And maybe I'm wrong, and I just wanted to give you a chance to clarify. Are you against all work requirements for able-bodied adults no matter what, or are you specifically against this bill? And certainly because of the unintended consequences or the reporting systems in Arkansas. I'm not saying those aren't valid, or the response rate for Missouri currently under our existing system. But because of those things, it sounded to me like it wasn't against this bill as much as it was against any work requirement whatsoever.
So we have opposition on many levels. I pointed out to the exemption issue, but we also want people to be able to access screening so they can get their cancers diagnosed at an early stage.
And working adults can't receive access to screening?
Well, we want people to have consistent access to their coverage, and we know that often people that are on Medicaid are in the gig economy and have jobs here and there. So with recording requirements, depending on how the state may implement those, we don't, once again, have confidence that people will be able to consistently maintain their Medicaid coverage.
Okay, so I think what I hear you saying is, yes, you do oppose all work requirements and also this bill.
Yes.
Okay, great. Thank
That
you
is our
so much.
organization's position. Thank you.
Are there any other questions for this witness, Senator Moon?
Just piggybacking on your question, Madam Chair, on page 2, section 3, it does list some exceptions there. Are there other concerns outside that section that causes your opposition?
So as I mentioned,
Line 33.
Okay, so
in
your
that section.
page 2 section.
Yeah, section 3 starts on line 31, but the exceptions are starting on 33 through 30. Well, it goes on to the next page.
So just going to my initial point, exceptions are only as good as their ability to be implemented. So if patients aren't aware that they're exempt, or for instance, the way that department implements this is a doctor's note every month, can you imagine going through cancer treatment and the stress that you're dealing with and all of the other issues that you're dealing with, and then also trying to make sure that a system that you can't get through to on the phone has regularly received your proof of your employment or that you are unable to work. We just don't have a great deal of confidence that that would be successful. So to our point, first of all, the exemptions may be well intended, but in the one state that has tried to do this, that was unsuccessful.
With
And
the
cancer
exemptions-
patients did lose their coverage.
I just wanted to make the point with the exemptions in place, if a person had an idea that they might need medical treatment, would they not go seek the help, and these exemptions would cover them so they would be able to get the treatment?
So the Department of Social Services would be the ones charged with implementing those exemptions. And as you know, I know there are well-intentioned individuals there, but as I mentioned, they're behind the federal rate in processing their applications. They have a number of burdens on the system right now, and they are unable to answer the phone timely. So if there is a issue with a cancer patient in the midst of their treatment, being able to prove whatever requirements are implemented for exemptions, I don't have confidence that they would be able to get that addressed quickly.
Any other questions for this witness? Seeing none, thank you for your testimony.
Thank you.
Next witness in opposition, please come forward.
Hello, my name's Brian Colby. I'm happy to be here. I'm with the Missouri Budget Project. We're a nonprofit, nonpartisan organization that does budget and fiscal analysis. And we appreciate the motivation I think that the sponsor has. Work is a good thing for everybody who can do it and is able to do it. But having a work requirement is a very expensive proposition, unfortunately. It's been tried in a couple other states, and the administrative costs are very high. The costs come in kind of two buckets. One is administration. You have to hire people to go through the paperwork, to receive the paperwork. Those expenses receive a federal match, but still the state portion is very expensive. And then there's a little-known cost, which is really an unfunded federal mandate that requires that if you have a work requirement in Medicaid, you also have to have work support. So you have to provide transportation, child care, work training and other types of things. Indiana, in anticipation of implementing work requirements, estimated that the cost was about $90 per month per participant. And if you would apply that for what the estimate of our department would be of those who would be required to have this designation, it would be somewhere in the area of about $30 million. And so our report outlines what the GAO, the Governmental Accountability Organization, looked at the administrative expenses on the federal side and were worried about work requirements because the costs are so high. And for that reason, we're in opposition and happy to answer any questions.
Thank you, Mr. Colby, for being here. I do have a follow-up question for you. And it's the same question. So are you opposed to all work requirements or to the specifics of this particular bill?
What brings our opposition is the difficulty in the administration and the cost that comes with it, that unfunded federal mandate. We appreciate the fact that work is important in people's life, and if people can do it, we should do it. It's just so difficult to implement and so costly that brings our opposition.
So it sounds like you are opposed to the idea and to this specific bill. Because when I read the bill, a lot of the times we have been looking at this idea for a number of years, and this while I served in the House as well as in the Senate. And if you look at page 3, lines 51 through 54, this bill in particular addresses where most of the costs have come from in the past, which is a disallowance from state participation where federally there is allowed participation, and how that becomes so difficult to implement that the cost savings, therefore, it ends up being more expensive to implement a work requirement to the state than the cost savings by having people who are able to work be able to work. So I appreciate your testimony, but it sounds to me like your testimony is, I don't necessarily care about which version it is that your experience or your testimony is, that any version you've seen you have not supported.
Well, I think that's probably a correct characterization, and it has not been supported by the courts. The establishment statute of the Social Security Act of 1965 doesn't talk about work, doesn't talk about getting people to work. It talks about getting people to health care, and that's why when it goes to the courts, a lot of times the courts have ruled that work requirements are not within the statute of the Medicaid program at the federal level. So
and again, this bill specifically has a carve out for participants of programs so that there is no ruling to make sure that that legal hurdle is not hit. So I appreciate your testimony and highlighting that. Any other questions for the witness? Thank you. Next witness in opposition.
Madam Chair, members of the committee, my name is Jay Hardenbrook. I'm the Advocacy Director for AARP here in the state of Missouri. We are a social change organization with a membership of over 700,000 in the state of Missouri alone. So probably many of you remember our support for the Medicaid expansion ballot initiative. And specifically, one of the things we wanted to make sure was in there was that there would be a disallowance of having work requirements on the Medicaid program. And that is due to the 800,000 family caregivers that we have in the state of Missouri. If you are a family caregiver caring for a loved one, oftentimes you have to leave your work. We wanted to make sure, and we estimate that about 18,000 family caregivers in the state of Missouri will be eligible for Medicaid under expansion. And we want to make sure that they are able to maintain their health coverage while they care for a loved one.
Thank you for your testimony. Have you had a chance to read this particular bill? Because if you do, you'll see on page 3, lines 47 through 50, there's specifically a carve out for caregivers of adults. And so
I believe it's dependent adults, though.
Well, isn't that what you're talking about?
No, because that's a legal term. So that means that they are a legal tax dependent of that person.
Well, it says actually, sir, it says caregiver, primary caregiver, or, well, I see, okay, or a dependent adult.
Yep.
Well, okay, so if that were addressed, would that eliminate AARP's concerns?
Possibly, especially if you could make it so that they didn't have to continually come back month after month. And
well, there is
verify
no
that
month
they're
over
caring.
month. I'm so glad that you brought that up.
Yep.
In fact, that was testimony from a previous witness that I chose not to correct, but there is only an annual requirement under the specific bill, which is most of why I'm asking questions about do you oppose this idea no matter how it's implemented, which sounds like most of the prior witnesses do, or do you not like this bill because many of the concerns that are specifically addressed in the testimony are already addressed by this language?
I am happy to work with the sponsor and with you on figuring out the best
Okay.
way to handle family caregivers. Yes.
Well, and then actually, I will draw your attention to, if you look at page 4, I think that this takes care of it as well. Thank you, Dr. Haskins, for highlighting this for me. Line 77 through 79, the participation or an immediate family member in the home experiences a hospitalization or serious illness. So again, maybe
But,
that's another
yeah.
spot that could be changed to
Or
be a
expanded.
primary
Yep.
caregiver or a caregiving of a primary caregiver would take care of that of another family member.
Yeah. Yeah.
So-
there are ways to expand that language.
I think so,
yes,
too.
And we're happy to work with you on that.
I appreciate that. Thank you. Any other questions for this witness? Seeing none. Thank you. Next witness in opposition.
Thank you, Madam Chair, members of the committee. Sam Panettiere, registered lobbyist on behalf of the Health Forward Foundation in Kansas City. I'd like to go on record in opposition to the bill and also to the general premise of work requirements. Understand the sentiment that you're trying to, achieve here. We just think it's a undue burden, obstacle on those trying to access health care, unnecessary red tape, and think that, according to Health and Human Services, 95% of the folks already would meet the requirements. It's just that burden of trying to comply with the paperwork and present it.
Is your organization opposed to annual paperwork in general on everything, or just this particular idea?
As it pertains to access to health care particularly.
Okay, thank you so much. Any other questions for this witness? Seeing none. Thank you for your testimony. Anyone else in opposition?
Hi there.
Thank you for being here.
Jeanette Mott Oxford for Paraquat. We're kind of laughing a little bit because I was here earlier to support a bill about having to say you're still permanently disabled to get your placard renewed for accessible parking. But it is Disability Rights Legislative Day. It's good to be here in the building for 3 different bills today that are about people with disabilities. So thanks for scheduling them on a day that a lot of us are here. Many of us who are disabled work, obviously. So disability does not necessarily mean that we're not working. My friend here in the front row with me, Michelle, also a hardworking person with a disability. We think that the problem here is work hour documentation because often people are hurt basically just by the red tape of it of trying to survive. And balance the amount of burdensome proof kind of regulations that get put on them. This happens to people already, certainly. Folks have been falling off of Medicaid recently with the renewal that came after the public health epidemic, and many of them really still do qualify. It's just that they can't get together the time and energy to prove they still qualify, given eviction notices, utility disconnection notices, refrigerators breaking down, tires that get ruined when you hit a pothole, and fixing all of this with the level of income that a lot of people have while trying to meet bureaucratic red tape can be a real challenge for folks. So that's our concern. We think the Family Support Division isn't up to something, adding another complicated layer like this because things aren't going so well. You all made a really good decision last year by adding Representative Melanie Stennett's Ticket to Work legislation to Senate Bill 106. And they're still actually approving people through hand calculations right now. That's not being automated. Family Support Division should automate that. It would help us get more people qualified. And we're having to fight to get some people qualified for it. So Family Support Division, the other day, someone told me that they'd called and said that there's 158 people ahead of them in the queue. Innocent people will suffer if we try this approach. Let's make the eligibility rules relate to the true cost of living, and people who want to work people will choose what works best for them generally. And if we make it where that they can manage to work without punishment, it will encourage people to work. Let's have realistic eligibility guidelines.
Thank you for your testimony. I'm glad that Paraquat's here to testify, and Ms. Mott Oxford, I have a question for you. One of the things that I'm concerned about is how do we pull out so that those who have disabilities that prevent themselves from being able to work without having too large of a net and catching people who, as you say and you advocate so clearly for on a daily basis, that those who have disabilities have real value to our community, are active contributing members of our communities, and to just disregard them as saying you do not have to do anything in order to qualify, whether there's a better way to make sure that we're ensuring that everybody has the same level of access as well as the same expectations.
Yeah, that certainly meets with our independent living philosophy, is that we want people to be able to pursue, the best life that they can with choices of their own. And part of that really is, can we actually set up guidelines in ways that are about the true cost of living? We don't do that. And people are creamed by it constantly. A lot of it is we set the federal poverty level. The formula for that was created in the 1950s and 60s, based only on the cost of food, nothing else. That's how the federal poverty level is calculated. The prices of other things, rent, transportation, et cetera, have gone up by different amounts than food has over time.
Unfortunately, energy as well, those categories have all gotten very expensive in the last few years.
And so as long as we use a federal poverty level that has nothing to do with the cost of living, our programs are going to be a mess and people are going to be hurt by them. What if we had some honesty in how we set eligibility guidelines? That would do more than anything in the world. What if we base stuff on honesty?
Well, I join you in wanting that as well.
Yeah.
So thank you for your testimony. Any questions for this witness, Senator Moon?
Thank you. Thank you for being here, Ms. Mott Oxford. I had a question with regard to the accommodations that would be required for those who may need certain accommodations to participate in community involvement and work, things like that. Even with those, does that help alleviate some of the opposition that you might have with requiring able-bodied people to work?
I really appreciate it when accommodations are there. That's one of the things that we do is help employers know what accommodations are available to assist with a worker. One of my coworkers, an accommodation that we provide for her because she was only born with one leg, is a scooter, because we have a big building and she's able to drive around the building on the scooter. And we just recently had to replace the battery on that, and she'd put it on her credit card, and I said, we should pay for that, and because it's a workplace accommodation, so we believe in accommodations, but we think that basically we should focus on providing the supports and the encouragement and giving everyone a vision that they can aspire to live the life of their dreams, and that will take care of the issue, we think.
Well, I visited Paraquat, and you have a great organization.
Thank you.
And I think that's commendable, that what you're doing. I'm just saying that for society as a whole, I think the intent of this bill is to actually require those who are able-bodied to participate, as opposed to just to getting something for nothing.
Yep.
And I know there's probably some differences in the situation you're describing at Paraquat, and I understand that. But I think in general, I believe we've gotten to a point where there's an expectation of just, well, it's there, I'm entitled, and you get it. And that's not what you guys are doing there, I know.
Well, no, and Senator Moon, it's interesting that I love the name of the gentleman's ministry from when that he started in, what was it,
Water
Joplin?
Gardens.
The Water Gardens.
Yes.
Because I recognize it as being from Isaiah 58, which is about the fact that the thens we get in society are about the ifs that we choose. If we share our bread with the hungry, if we bring the homeless poor into our own homes, if we remove the pointing of the finger and the speaking of evil, then the light will shine. Then you will be like a watered garden. Then your bones will be strong. Then you'll be called restorers of streets fit to live in and repairers of the breach. I love that chapter. That is my chapter. That is my favorite chapter of Hebrew Scripture. And that's the way we ought to live. But that is about inviting people into a community where we recognize everybody is kin. There's a part in that says you don't hide yourself from your kin. We are all kin. let's live like we're kin. And if we live like we're kin, it's about inviting people into active participation instead of trying to punish people. If we didn't have so much punishment, this stuff wouldn't be happening, is what I sincerely believe.
And through the bond of Christ, that would be a workable thing, and that's what we need to work toward. I appreciate your testimony. Thank you.
Thank you so much for being here today. Next witness in opposition. Can I just get a show of hands while we're switching witnesses of who else is here to testify on this bill? Okay, great. Thank you.
Oh, I thought I'd get to wrap it up.
Oh, we have one for informational purposes still,
Okay,
so
excellent.
you're
Well,
almost
I
at the
almost
end.
get to wrap it up then.
Yeah, thank you.
Thanks so much for having me. Good morning. My name is Sarah Owsley. I'm here on behalf of Empower Missouri. We also want to go on record in opposition to this language. We certainly testify a lot against work hour tracking, in large part because it is expensive for the state. It is prone to accidents and errors, and it is burdensome for individuals to be able to actually get that information. We know often people in poverty are hourly workers, and they do not have the type of bosses and supervisors who are prone to want to cooperate with this type of thing. And so we hear a lot from hourly workers or people in poverty who are like, yeah, I've asked for that repeatedly. I can't get it in time. If I finally get it, it's post-dated so much that it's not relevant any longer, and then I can't reach DSS to lodge some sort of opposition. So those are our concerns, and thank you so much.
Thank you for your testimony, Ms. Owsley. Any questions for this witness? Thank you for being here.
So I've got written testimony for you as well. Do you want me to leave it here or hand it
Yes,
to you?
please. That's
okay,
great.
Perfect.
Thank you. Okay, anyone here for informational purposes only?
Morning, Madam Chair, members of the committee. My name is Ryan Conway, Legislative Director for the Department of Social Services. Just a little, very briefly, wanted to hit on, in terms of administration, it should, let's say, should the General Assembly pass this, should the voters approve it, administration of the program, the department, as Senator Carter wrote in the SJR, we will seek a waiver from federal government. So that opens up the ability for the Department of the Family Support Division to work with subject matter experts within CMS and within the federal system who are, believe it or not, are very helpful people. I mean, I know there's a lot of times we get the idea it's a state and federal governments clash, but in terms of administration, there are career people who become policy experts who are actually very helpful in terms of crafting how exactly to administer programs. And so while it certainly is true that wait times, phone wait times are not what we want them to be, and it's a very difficult proposition to tackle that down. We'd like it to be one ring and every phone call's answered, but that's obviously not something that we're at now, and probably would be very difficult hill to climb. We would be able to work with our partners and our friends in CMS to be able to craft how this could be something that is not overly burdensome and accomplishes the intent of the General Assembly. Because after all, we as a department are vessels of the General Assembly. You tell us what the policy is, we execute it to the best of our ability. And so with that in mind, how we would go about that would be working with subject matter experts to create something that's not overly burdensome but still does what you all tell us you want us to do. That's kind of the main point I wanted to hit, but if there are any questions, I'd certainly love the opportunity to try to answer those.
Thank you for being here today. I have a quick question. Is there anything that's prohibiting the administration from seeking a waiver to have work requirements today?
So I think we would run into perhaps a constitutional problem with the way the expansion amendment. I'm
not asking about the expansion. Oh, I see what you're saying.
So
Okay.
we would be prohibited from that work requirement. I think. I don't want to necessarily.
Your interpretation is that there's a concern.
If there'd be a concern, certainly we would be happy to explore that more. And if
That would
that
be
in fact
great.
is not accurate, again, vessels of the General Assembly, you tell us what you want, we do it.
Well, I guess my point is the department is not prohibited from pursuing waivers without approval from the General Assembly. Isn't that accurate?
Yeah, that would be correct. Yes,
Okay,
Senator.
great. Any other questions for this witness? Thanks so much for being here.
Thank you.
That will conclude our hearing on SJR 76. Senator Thompson Rehder, when you're ready, please feel free to present either of your bills that you'd like to start with.
You're fine. Human trafficking.
Okay, so we're going to start with Senate Bill 1245 whenever you are ready.
Thank you, Madam Chairwoman and members of this committee. I'm Senator Holly Thompson Rehder, presenting a bill that came from our interim committee that we had on child exploitation and sex trafficking in the state. This bill, it repeals several references to child pornography and offenses and offenses relating to child pornography, and adds references to child sexual abuse material and offenses relating to child sexual abuse material. What we were doing is we were trying to get consistent across our statutes with the way that our language was reading on child exploitation and sex trafficking, because we had kind of a mesh across the board. It also repeals references to sexual contact with a prisoner or offender, and changes that to references to sexual conduct in the course of public duty. So what we did is we just went through the statutes, tried to make those consistent. This act also repeals provisions relating to the statewide Council on Sex Trafficking and Sexual Exploitation of Children within the Department of Social Services, and it creates under the Attorney General's office the statewide Council Against Adult Trafficking and the Commercial Sexual Exploitation of Children. That way we can be consistent with what the AG's office has been doing and has, so that what we have now is kind of a patchwork across the state. That's one of the things that the council found in our interim committee. And so we're attempting to pull all of those together under the AG's office. One, to save resources, of course. Two, to expedite, getting things accomplished and finding those problems and fixing them, to have it all in the same kind of hub. Under current law, we are also changing admissibility of evidence in criminal cases. Under current law, a statement made by a child under 14 years of age may be admissible in criminal proceedings under certain circumstances. This act changes the age to a child under the age of 18 years. Additionally, this bill provides that visual or audio recordings of a child under 18 years of age or a vulnerable person relating to certain criminal offenses shall be admissible in criminal proceedings under certain circumstances. Also, currently, a civil action for recovery of damage suffered as a result of childhood sexual abuse shall be brought within 10 years after the victim reaches the age of 21, or within 3 years of the victim discovering that the injury or illness was caused by childhood sexual abuse, whichever is later. So that section, I'm actually going to have a sub. I've been working with some others, and I know yesterday we heard Senator Eigel's amendment in language, and I think that his is written better and something that has more agreement upon. And so I do have someone coming up behind me that is an attorney and is going to be able to speak to that section much clearer than myself. This act also modifies the offenses included in the definition of childhood sexual abuse. And then under current law, a person over 21 years of age commits the offense of enticement of a child if he or she persuades any person less than 15 years old to engage in sexual conduct. This bill changes the age to less than 17 years old. Additionally, this act modifies the offense of patronizing prostitution. If the person patronized for prostitution is ages 15 to 17, it's going to be a Class E felony, and if the person is less than 15, it's going to be a Class B felony. It also provides that a prosecuting or circuit attorney may request assistance from the AG's office to assist in prosecution of child sex trafficking, and may also utilize the resources of the AG's office, which again, we're kind of pulling it all together there. This bill also modifies the offense of sexual trafficking of a child in the second degree to provide that if the offense is committed by a parent, legal guardian, or other person having custody or control of that child, the punishment shall be a felony with life imprisonment. Finally, this bill provides that any real or personal property used in the commission of a sexual trafficking offense may be seized and forfeited subject to the Criminal Activity Forfeiture Act. Any remaining proceeds from the sale of the property after satisfying any lien shall go to the victims of sexual trafficking. We have several witnesses that are going to testify, and with that, I'm happy to answer any questions.
Thank you for your testimony. Are there any questions? Thank you, Sir Arthur.
I guess it's more for the people here. Is there someone from the AG's office? Then I guess I'll talk with you. Have you had conversations with the AG's office about their interest in this topic and whether they feel like they could take on the responsibilities?
Yes, they were a part of the interim committee.
Oh, okay.
Clifton Davis is the appointed attorney that heads up the sex trafficking.
Okay, perfect.
Over in the AG's office. And he asked me if he needed to stay for the committee. He was here this morning, and I told him I didn't think so, so I apologize for that.
Okay. I just wanted to make
First question out of the box.
I wanted to make sure that they were on board and there wasn't any pushback. So
they were
that's great
absolutely
news.
a part of it through the whole interim committee, and have been incredibly helpful.
Very good. Thank you.
Any other questions for the Senator? I have one briefly. There are two other bills that are being that have been distributed that deal with child pornographic materials, dealing with those that are AI generated, and then also I can't think of an alternative name for this, and I'm racking my brain because it's just so crass, but sex dolls that are made in the image and likeness of children, as well as AI generated materials. Would you be open to including that since we're opening up that definition?
Yes, and this bill actually does touch on
both of those, or
sex
the AI?
dolls.
Okay. Thank you. There's not another term for that. I wish there were. Okay, thank you so much. First witness in support, please come forward.
There's nothing. We are not.
Hi, good morning. I'm Jessica Seitz. I'm the Executive Director of the Missouri Network Against Child Abuse, formerly known as Missouri Kids First. So we went through a rebrand and name change a couple of weeks ago, so it's taking some getting used to. I've got a couple of points, and then I can probably answer some of the questions you have or tell you who can if I can't. My organization is very grateful to Senator Thompson Rehder for putting this legislation in. I was an appointed member of this, I've got the report here, and the long name. We were appointed member of the Missouri Statewide Council on Sex Trafficking and Sexual Exploitation of Children that was established in statute 2 years ago. That language, there were a lot of bills that being considered in 2021 and 2022 that related to sex trafficking. Everybody recognized it was an issue, but wasn't quite sure what we wanted to do, whether it should be pursued in the family court, in the criminal court, what the data said. So everyone said, let's pump the brakes and form a task force. And it really did help. And the report, the task force, or excuse me, the council, did sunset at the end of 2023 as it currently stands, and released this report. And so it was a good, thoughtful experience that the senator was on. So a couple of really exciting or very important things we think are included in this legislation. One of the reasons it's so long is that there are multiple criminal provisions where they change the language. It's a simple change from child pornography to child sexual abuse material. In the field, we call that CSAM. And it's as simple as it sounds. It is the term child pornography implies some kind of consent, and the field has recognized that, let's call it what it is, child sexual abuse material. The same change is being considered at the federal level as well, actually by Representative Wagner has put legislation forward. It has changed in some of the states across the country. It's simple, but it is included in multiple provisions. So if you're wondering why the bill's so long, it's because there's multiple statutes. We think that is sort of low-hanging fruit. And works to making our laws recognize trafficking for what it is. Just a few other, the provisions related to admissibility, 491 and 492 that are in here, you all passed, this is included in a number of bills. There's actually, I think, 10 in this building that have that language in it. We're going to pass that. And so that improves, it allows for the admissibility of statements related to abuse, currently allowable to only for kids under 14, would extend that to change under 17. 14 to 17-year-olds are still kids too, and they're an incredibly vulnerable population to sexual abuse and sex trafficking, and they should be protected. Those laws are intended to reduce the amount of trauma of coming to court multiple times to talk about these crimes, and this protection that we've had for under 14 extended. And speaking of 14 to 17-year-old, again, I cannot emphasize enough, they're still kids. You all know it. I know it. There are provisions in here related to enticement of a child. Right now, that crime is under 15, extends it to under 17. Same mindset. So happy those are findings of the council. And we were excited to see essentially the statewide council extended and kind of clarified so that it would continue the work. And with related to statute of limitations on civil actions, I'm open to a conversation. We support the extension of the civil statute of limitations for child sexual abuse. There are a number of bills being considered, like changing the length and who it applies to. So I'm not sure what's being thrown around. I got a little lost, but we are supportive of that and would love to be on the conversations because these crimes are very vulnerable. Often victims do not come forward until well into adulthood. The research shows it. And so any type of protections that our law can do, improvements to Missouri law, should be considered. So with that, I close.
Great, thank you so much. Any questions for this witness? Seeing none, thank you for being here today. Next witness in support, please come forward. Anyone else here in support? Anyone here in opposition? Anyone here for informational purposes only?
Hi, Rich Aubuchon here on behalf of the Missouri Civil Justice Reform Coalition. First, I want to thank the sponsor for all the work that she's done on this issue. A very laudable effort to stop human trafficking, which is an awful thing. There is one little piece in the bill that we've talked with her about in regard to a cause of action, and we have believedly come to a deal on that issue that I believe will still advance the cause of protecting children. while also punishing people who do the bad deeds that are done. So we appreciate her and her work.
Great. Any questions for this witness? Seeing none, thank you for your testimony.
Thank you.
Anyone else here for informational purposes only? Seeing none, that will conclude the Senate committee. Oh, I'm so sorry. You were going to come forward. If you want to go on the record.
Ditto.
Awesome. We got you on the record. Ditto. We now are concluding the hearing on Senate Bill 1245. And before we move to your Senate Bill 1336, I need to correct the record. My office has let me know that St. Luke's also complied with the request, and I apologize sincerely to St. Luke's and their leadership. I appreciate their effort to make sure that we got that information, and I'm sorry for inadvertently leaving you off of that list. So shout out to St. Luke's. Good job. Thanks. Sorry about that. Senator, please proceed when ready.
Thank you so much. Again, Senator Holly Thompson Rehder from Southeast Missouri. This is the same bill that we passed last year. My language was added as an amendment to Senator Esslinger's bill, and then the Supreme Court struck that down as saying that this language wasn't a part of the original intent under the title, and they couldn't, even though we have the severability clauses, they couldn't take it apart because they said they didn't know, their findings were they didn't know if the bill would have passed without this piece. So here we are again. Senator Moon, stop smiling. I know that's your bailiwick there, so I get it. So this bill, again, we were able to get it passed last year. You know, homelessness is, we have all seen it across our districts. And certainly, you know, front page of the Post-Dispatch just a couple of weeks ago had, you know, a couple who had we have to do something. What we are doing is not working. And so the federal guidelines of Housing First really the data does not support that is the process in which to help homelessness. So this bill couples short-term housing for the homeless with mental health help, because when you have studies show that you have 75% of our homeless are in a mental health crisis, 75% are in substance use, and so addiction. And so with that, we are not, just by putting someone in Housing First is not helping what the issue is, what the core problem is. So focusing our state resources, of course we can't do anything with the federal resources, focusing our state resources on shelters and mental health services over a free housing unit is a new approach that's been going through the states for the past 3 years, I believe. What I saw when I went and visited Austin, because of the work that they've done there in that large county, was that they had prioritized encampments with, and then also 24-hour shelters with staff being available to help people get signed up for services, and getting folks into the mental health services that they need. The statistics have shown that the numbers have really dropped in the unsheltered in that county, the homeless that are unsheltered in that county into sheltered homeless. And I think that that's really important. The only negative that really, the pushback on this bill was the misdemeanor charge if you are told twice, because it doesn't allow camping on state property. The pushback is, hey, I can't believe that you're going to, ticket a homeless person. Well, that's not, in Texas, not one person got ticketed, because number one, you are only removed on state property if there's a 24-hour shelter for that officer to move you to. And so the first time that you refuse to go to that 24-hour shelter, you're given a warning. The second time that you refuse to be taken to a 24-hour shelter is when you're giving the citation. So this is only done in places that there is a 24-hour shelter for you. So for instance, Cape Girardeau, which is, my largest community, they said, Holly, what are we supposed to do? We don't have a 24-hour shelter. And I said, well, that portion doesn't apply to you because you don't have a 24-hour shelter. What we're trying to do is get folks where there are 24-hour shelters available, get them into temporary housing with someone that is getting them hooked up to the mental health services. So with that, we do have some folks that can speak to some of the details, might be able to answer some questions coming up behind me, and I'm happy to answer any questions.
Thank you so much. I just wanted to say that this is, I think, an example of the Supreme Court and the Missouri plan really failing the state. There has been no legislative precedence and no historical precedence that if a bill provision did not pass independently or that there was any even legislative intent research that's done in the courts of law. I think that that was a convenient excuse that was found. So just not going to miss a chance to say I think the Supreme Court's way off base here, but Senator Moon may disagree. And anyways, any questions for the bill handler? Senator Moon.
And just to comment on both your comment and the reaction to my smile, it was not that I don't want your bill to pass.
No,
I just
know.
think
I know
that we
that.
need to be extremely careful in how we do this and bring it up as a single issue. It's great. I support it. Thank you.
Right. Thank you.
First witness in support, please come forward.
Thank you, Chair Coleman and committee members, for giving me the opportunity to support this bill. My name is Devin Kurtz, and I'm the Director of Public Safety Policy at Cicero Action, a nonprofit that advocates for entrepreneurial solutions to public policy problems across the country. We're based in Austin, Texas. Homelessness in Missouri has changed considerably in the previous decade. While today total homelessness in Missouri is marginally lower than 10 years ago, those same numbers have been getting worse since 2018, rising 22.8% over 5 years. Moreover, the number of unsheltered homeless, the most vulnerable subgroup of the homeless population and those that we encounter on the street, has grown by 38.7% since 2013 and 77.7% since 2018. And today, fewer homeless Missourians have access to shelter than a decade ago. 1 in 4 homeless people were without shelter in 2013, but today that figure is now nearly 1 in 3. These figures have come about while Missouri has followed the Housing First policies touted by the federal government, activists, and academics. But the promises of Housing First have not come to fruition, and homeless people in Missouri are worse off today than a decade ago. Since 2013, Missouri has lost 42% of its transitional housing capacity, in large part because Housing First deprioritizes these units in favor of permanent units, which have increased by 71% over that period. Short-term shelter space has grown by a mere 1% statewide, despite the rapid increase of unsheltered homelessness. The reprioritization of permanently subsidized units over transitional units that expect individuals to achieve some level of self-sustainability have not improved the situation. Instead, a homeless person in St. Louis who struggles with chronic substance abuse is now 3 times as likely to be on the street and without shelter as in 2013. For those with severe mental illness, that figure has increased by about 80% over the same period. In Kansas City, rates of severe mental illness and chronic substance abuse among unsheltered homeless people compared to the total homeless population have increased 128% and 137% respectively. The most vulnerable homeless individuals are not helped by Housing First or policies that allow people to suffer on city streets when they are in crisis. This bill revives legislation that targeted the aspects of homelessness that Housing First ignores. Namely, it reverses the damage that Housing First has done to short-term and transitional housing by prioritizing state funds for these interventions, as well as temporary camping facilities and substance abuse and mental health services. Moreover, this bill creates basic performance metrics upon which to base homelessness funding to ensure that state funds are used most effectively over the long term. Finally, it prohibits camping on state land and empowers the Attorney General to ensure that municipalities protect the public by properly intervening when homeless encampments appear in their jurisdictions. Political subdivisions are further held accountable if they permit rampant camping by being denied state homelessness funding until they enforce their ordinances. This bill is good policy based on successes we've seen in places like Austin and San Antonio. While some of this bill's concepts have been politicized, the reality is that communities that are dealing with homelessness end up turning to many of these solutions in the face of housing first failures anyways. Structured camping facilities have become an accepted and necessary stopgap in cities like Madison, Wisconsin, where Housing First has limited their short-term housing capacity. States like California have filed amicus briefs with the Supreme Court in support of being able to enforce camping ban ordinances because of the ineffectiveness of other interventions that have left their communities in turmoil. Here in Missouri, recent polling from the Cicero Institute found that nearly 2 out of 3 voters see street camps as dangerous, and 77% avoid areas with homeless camps. More than 80% of voters from both parties believe it is more compassionate to move homeless individuals into shelters than to allow street camping, and 60% of voters support reinstating the law that bans street camping. This bill offers Missouri a sensible path forward that aligns with what the public expects of its leaders on this issue. Thank you for your attention. I'm happy to answer any additional questions.
Thank you for your testimony. Are there any questions for this witness? Seeing none, thank you for being here today. Next witness in support. Anyone here in opposition? Please come forward.
Good morning. Thank you for having me today. My name is Markea Watson. I am a social worker and the executive director of the Greater Kansas City Coalition to End Homelessness. We are the lead agency for the continuum of care in Jackson County, Missouri. Homelessness is a housing, healthcare, and public safety issue, not a criminal justice one, and one that is obviously complex and that has proven difficult to solve. Communities are rightfully frustrated, and while I respect the spirit of what this bill seeks to do, it does not account for the work already being done to end homelessness, especially that which is governed by the continuum of care, 8 of them in the state of Missouri. I will be honest with you and say that as a representative of Kansas City COC lead agency, it's very confusing to me how many of the technical requirements of this bill would be undertaken, which agencies would be responsible, and how these activities would be funded. COCs must, as mandated by the federal government, utilize a housing first framework in service delivery, which is at odds with the language in this bill. The bill also does not reference or support rigorous federal regulations attached to our funding, norms and ethics of the helping professions, or evidence-based interventions. Moving funding from successful programs and nonprofits, and essentially punishing jurisdictions for increased homeless numbers by pulling resources is not an effective homeless response, as there are many variables, internal and external, that influence the size of the homeless population at a given time. The integrity of the federally required census of homelessness could thus be greatly compromised, as this bill incentivizes undercounting homelessness rather than accurately quantifying the problem so programs can be designed to scale. And as the adage goes, you cannot fix what you do not measure. Additionally, emergency shelter is a very temporary intervention to get people to safety, something like 14 to 30 days. And the newest research out of UCLA suggests very little difference in health outcomes between sheltered and unsheltered populations, and that encampment sweeps are costly, ineffective, and delay rather than accelerate housing placements. Long-term goals such as employment, increased income and benefits, and improved health are best pursued in housing, not emergency shelter or encampments, whether legal or otherwise. Emergency shelter is not an appropriate housing model for many folks we encounter on the streets. Service requirements as defined in this bill, especially those required for mental health and substance use evaluations, discourage rather than encourage program participation, and it is unclear who would perform these assessments and what that information would be used for, other than to punish people. It is also unclear procedurally how data such as the number of days a person spends in jail or in hospital would be obtained, as data sharing across systems is complicated, and there is currently no roadmap for doing this at scale across the state. As a professional social worker, it is unthinkable to me that I should ever be asked to enforce illegal camping. This is not our role, and it erodes trust needed to get people into housing. It is also unthinkable to me to support legislation that would inflict further harm on folks who already have so many barriers working against them. We are not all at the same starting point in terms of our health, our abilities, or our access to resources and wealth. And so I implore you to think of homelessness as the failure of a society, not an individual human being, and ask that you look into things like MoDOT's encampment closure pilot program currently underway in Kansas City, which is producing very promising outcomes. I also ask that you work toward more humane, trauma-informed, and practicable solutions in collaboration with the subject matter experts already living and deeply invested in this work in your local communities, and that you explore opportunities to strengthen the supportive housing programs operated by the state mental health agency by augmenting those with programs with funding for the services needed to make them successful, as they were funded by an antiquated program model and do not have a line item for case management, which is critical to getting people to move forward. Your local service providers are not failing. They need your help to access more resources and your help to remove barriers from their path, not impose them. Thank you.
Thank you. Do you mind getting a copy, or at least just a citation of the UCLA study that you said? I'd love to see that.
I have it.
Thank
Here,
you so
I can
much.
give you a Dropbox.
I appreciate that.
Yeah, absolutely.
Anybody have any other questions for this witness? Thank you for being here today. Anyone else here in opposition, please come forward.
Madam Chair, members of the committee, Jeanette Mott, Oxford for Paraquad. Unfortunately, people with disabilities do have a 2 to 3 times higher poverty rate, and this means that many people with disabilities do have spells of homelessness. Our concern is mainly the criminalization part, as Senator Rehder cited. Once you do have arrests and incarcerations on your record, it complicates your ability to move forward on your life goals, and we would prefer to have our state energy directed toward increasing affordable, available housing stock. The National Low Income Housing Coalition says, I think at this point we have something like 41 units of affordable available housing available out of each 100 needed for those living at 30% of area median income and down. So there's an incredible shortage of affordable available housing stock. So if we would focus our efforts on making sure that people can get into housing, hopefully the problem would be alleviated. So that's our main concern, is just people with disabilities may have further barriers erected to success in their lives.
Thank you for your testimony. Any questions for this witness? Seeing none.
Thank you.
Anyone else here in opposition, please come forward.
Okay, good morning, all. Thank you for giving me this opportunity to express my opposition to this particular legislation. A couple things.
Before you start,
Yes, I'm sorry. My apologies. My name is Michelle Smith. I am the founder and director of an organization called Missouri Justice Coalition. And in my work, I focus on people who are incarcerated, both locally in my city, which is St. Louis, and also in our state Department of Corrections. A couple of things that I found kind of concerning in the bill. One, of course, is the criminalization aspect, but also I think that when we're talking about, the services that people need who are unhoused, I feel like taking money away from that housing that people need to be permanent and secure and stable, and putting it into mental health or substance abuse treatment is really taken away from a need that exists. Now, both of these issues, all of them need to be addressed. I don't think defunding one aspect to put money to another aspect is helpful. I think that as a state, we should do everything to make sure that our community is housed, that people who are vulnerable get everything they need, including permanent housing, including substance abuse treatment, including mental health treatment. And just being honest, we throw money at a lot of different things in this state that we don't need to. We, as people who have resources like a lot of the large property developers. I'm thinking about my own city, where a lot of these people get all of the property and redevelop them. And so there's a lot of housing available, but of course it's very expensive. $2,000-$3,000 a month is way beyond affordability for a lot of people. So if we actually take the money that we're doing with tax breaks, et cetera, for certain people, we would have the available funds to make sure that housing, permanent housing, is there. Also mental health treatment, also drug abuse treatment. And lastly, I'll say this. A lot of people in our states who are unhoused are working, are in school. There are people in my city of St. Louis, a significant population of the children in our school district are unhoused. People live in their cars, right? And they have jobs every day, and they go to the Y or they go to somewhere else to take a shower. So people are suffering, they're struggling, and to say, let's take away from those options to have permanent housing available and put that money into another aspect that is also necessary, I feel like is really making the problem worse, making a permanent housing problem worse, to take the money and do something else with it, when we are capable to finding the money and the support and the resources to help everybody, which includes supporting the organizations like the young lady that spoke earlier, who are doing this work directly. And in my own work, I deal with a lot of people who are unhoused in jail. And when they go to court, they are kept in jail because they don't have permanent housing. They don't have someone to come in. It's called a sponsored recognizance, to come in and sign them out. And the judge is keeping people in jail for the simple fact that they are unhoused. And so I just feel like we should be able to come up with better solutions than cutting the budget in one needed area and putting it in another needed area, and figure out how we can do everything. And again, like the wraparound services that we truly need for all of our community members, to get them to a place where they're secure, safe, housed, and get any treatment that they need. So that's my what I wanted to say today. So thank you all.
Thank you for your testimony and being here today. Anyone have any questions for this witness? Seeing none. Anyone else here in opposition, please come forward. Can I just get a show of hands, how many people would like to testify on this bill? Okay, great, thank you. I know you. Good job, Sarah.
Madam Chair and the esteemed members of this committee, my name is Jared Jenkins, and I come to you today to offer my testimony of personal experience in my opposition to the Senate Bill 1336. At the age of 17, I found myself experiencing hidden homelessness in Berry County, Missouri. While navigating limited resources and systematic barriers, I faced numerous obstacles that threatened to derail my path forward. Today, I come before you as a dedicated community social worker, a proud wife of a U.S. Army soldier, and a loving mother to 5 beautiful children. None of this would have been possible if I had been criminalized for my circumstances or left with temporary solutions like those proposed. I can attest that punitive actions and short-term solutions were barriers to me getting my high school diploma. While I wholeheartedly acknowledge the importance of addressing homelessness, I firmly believe that the answer is not to categorize homelessness as a misdemeanor. And it perpetuates harmful cycles of punishment and further marginalization. And honestly, it limits the individual's potential and their ability to give back to the communities in the state. I urge you to vote no and to instead focus on implementing compassionate best practices to address homelessness. And I implore you to consider the well-being and dignity of Missourians and explore other ways where homelessness is swiftly addressed with empathy, compassion, meaningful, permanent support.
Thank you for being here today, and thank you for your service to our country with your husband. Any questions for this witness? Seeing none, thank you for being here. Thank you.
I get to wrap this one up too. Lucky all of us. My name is Sarah Owsley. I'm with Empower Missouri. Thanks so much for giving me the opportunity to come and chat with you all about this bill. I do have a problem with the homelessness criminalization portion. That is not the only section of this language that we disagree with. We firmly believe that policy should center evidence and peer-reviewed data, not our feelings about public issues. And so it's important to note that the language does not say that only individuals who have access to a 24-hour shelter bed and refuse a shelter bed could be eligible for a misdemeanor. It does not clarify that, and that is not how it was enforced across Missouri for the portion of time that it was the law. We also don't really understand why we would put a misdemeanor that we believe will never be enforced if we are going off of the record of other states. We should not further our criminal code if we're not intending to enforce that language. Even if the language is changed to only offer that misdemeanor for folks who refuse shelter, there are significant barriers that exist. There is not a data reporting area that would that law enforcement would have access to that would say this shelter in this county has an open bed for you and you can take this person here. Often those shelters are only operated during extreme weather, and so if it's very cold or very hot, they may not be open during temperate weather. They also are often only overnight shelters or only day shelters, and so what would happen the next morning, this person would return to street homelessness even if they accepted a shelter bed placement tonight. So there's a number of issues with the criminalization language that would be difficult or expensive to remedy to be enforced in the way that I believe that the senator is intending that it would be enforced. I also just want to address some of the data here from Missouri. The data we count in our PIT count every year, all of our homeless services organizations get together, they work with volunteers and community members, and they count all the folks who are reporting themselves as homeless for that night. So we actually have a pretty good estimate about how many folks in Missouri are experiencing homelessness and what types of circumstances they're encountering. Because of that, we know that actually about 20% of individuals in Missouri who are homeless are reporting mental health challenges, and 14% are reporting substance use disorder. So it's important that we really address that those are issues that are prevalent in the homeless population, but it certainly is not most of the folks who are experiencing homelessness. It's also, we know that 60% of people experiencing homelessness nationally, as many as 60% are working. And so they are working, their wages are not enough to provide for their housing. That's what happens, right? If you can't provide for housing, we end up, unfortunately, experiencing bouts of homelessness in our communities. I also just want to sort of address a question that came to my mind as I was listening to some of the previous testimony, this idea of permanent supportive housing. And I want to clarify that that does not mean that we put people into housing and they never again have to look at their housing situation. No matter what happens, they are not removed. That feeling would feel bad to us, right? All of us, if we don't pay our rent or mortgage, we could be displaced. That is also true for people in permanent supportive housing. They are required to pay a portion of their income towards their housing, and if they don't do that, they can face eviction. They also are required to follow rules. If they were dealing drugs or there was a large incidence of violence or something like that in that home, they could be removed from that home as well. So it does not mean that they're placed in housing and then forever and ever they live on that program. In fact, that there are programmatic requirements. We know that folks in permanent supportive housing are much more likely to be able to sustain their housing in the long run than other folks who have experienced homelessness. As much as 88% of individuals who experience or who go through a permanent supportive housing program are able to maintain their housing in the long term. That's a huge success rate that we don't see really in any other social services. So we know that we're on the right track. We also know that folks who encounter a Housing First program, which you heard a little bit about, which is just the idea that people need to be in safety. They need to be in a place that I know I don't have to, I'm not on an arbitrary clock. I don't have to move things forward according to somebody's program standards. Instead, I can really look at what's best for myself and my family. Those individuals are much more likely to engage in services. They increase their wages. They increase their access and utilization of healthcare and mental health care. They decrease their interaction with police, and they significantly decrease the amount of emergency health care, which is much more expensive, ER stays, et cetera, compared to folks who stay on the street or who encounter a treatment first model, which is the idea that you must be screened for substance use disorder, you must be ready, housing ready. Those programs are failed. They have existed in the past across the United States, and we switched during the Bush administration towards a housing first model, which has been much more successful.
Thank you for your testimony. Any questions for this witness? Seeing none. Anyone else here? Thank you for being here. Anyone else here to testify in opposition? Anyone here for informational purposes only? And that will conclude our hearing. And
Can I?
Oh, go ahead. Absolutely.
Just wanted to clear up a couple of things. Section 5 clearly says no citation shall be issued unless that individual refuses to move to any offered services or shelter. We are not qualifying homelessness as misdemeanors. That is not what this is. The bill absolutely is very clear about that. And it's only talking about state funds. The federal funds, we're not allowed to touch. This has nothing to do with the federal funds or policies. This is only the state funds that are allocated on top of those federal funds. And in closing, I just want to say it's important to look at the statistics. When I was 15 and pregnant, I was couch surfing. I was homeless. This is not because I don't feel for the folks. It's because I do. It's because I understand that we have got to do more. The current policies are not working. Our homelessness is growing. We must do more to help people. It is inhumane to allow someone to sleep on the street when it is 10 degrees outside. So the current model is increasing our homelessness. We must do something about it. And this is a policy that now has evidence and has proven to cut down on the unsheltered homeless. And that's where we want to be as a state. Thank you so much.
Thank you very much. This concludes our hearing on Senate Bill 1336 and our Committee on Health and Welfare.